Have you ever woken up, or simply been sitting quietly, when suddenly your hands start to tingle? Perhaps it feels like pins and needles, or a numb sensation that just won't go away, making it hard to hold your morning cup of tea or button your shirt. It can be quite alarming, can't it? That's strange, sometimes unsettling. Feeling can leave you wondering what on earth is going on. It's a common experience, especially as we get a little older, and it can definitely interfere with the simple joys and necessities of everyday life. The good news is, while it's always wise to pay attention to your body, this tingling sensation isn't always a cause for major alarm, and understanding its possible origins can bring immense peace of mind and help you take the right steps. In this video, we're going to gently explore some of the most common reasons why your hands might be tingling after the age of 60. We'll look at several possibilities, from the everyday to those that might need a doctor's eye, and discuss practical things you can do to find relief. Understanding these potential causes is the first crucial step toward feeling more comfortable and in control. So, let's get to the bottom of this perplexing sensation together. Watch to the end for something that will surprise you. Let's dive into some of the most common explanations for that perplexing tingling sensation in your hands. One of the first things that often comes to mind, and for good reason, is something called carpal tunnel syndrome. You might have heard about it, or perhaps even know someone who has experienced it. Imagine a narrow passageway in your wrist, right at the base of your palm, called the carpal tunnel. Through this tunnel pass several tendons and a very important nerve, known as the median nerve. This nerve is responsible for sensation in your thumb, index finger, middle finger, and part of your ring finger. It also helps control some of the small muscles at the base of your thumb. Now, if the space inside this tunnel becomes constricted, perhaps due to swelling, inflammation, or even simply repetitive motions that put pressure on the area, that median nerve can get squeezed. When that nerve is compressed, it can send out those classic tingling, numbness, or even burning sensations into your fingers and hand. Sometimes, you might also feel weakness in your hand, making it hard to grip things, or notice that you're dropping objects more frequently. It often starts gradually, perhaps worse at night, waking you from sleep, or after long periods of activity like typing, knitting, or even driving. You might find yourself shaking out your hands in an attempt to get the feeling back, or to relieve the discomfort. This is your body's way of trying to free up that compressed nerve. For many people, carpal tunnel syndrome can be managed with relatively simple, non-invasive approaches. For instance, wearing a wrist splint, especially at night, can help keep your wrist in a neutral position, taking pressure off the nerve. Gentle stretching exercises, like extending your fingers and wrist, can also be helpful. It's also wise to pay attention to your posture and how you use your hands during daily activities. If your work or hobbies involve repetitive hand movements, taking regular breaks to stretch and rest your hands can make a significant difference. Sometimes, adjustments to your workstation or tools can also alleviate symptoms. If these initial steps don't bring relief, or if your symptoms worsen, it's really important to talk to your doctor. They might suggest other treatments, such as anti-inflammatory medications, physical therapy, or in some cases, a minor procedure to relieve the pressure on the nerve. Moving beyond carpal tunnel, another significant culprit behind tingling hands, especially after 60, is a condition known as peripheral neuropathy. Now, this sounds a bit more technical, but let's break it down in a way that makes sense. Our bodies have an incredible network of nerves, called the peripheral nervous system, that send information between your brain and spinal cord and the rest of your body, including your hands and feet. When these nerves get damaged or malfunction, it can lead to all sorts of unusual sensations, including tingling, numbness, burning, or even sharp pain. Unlike carpal tunnel, which usually affects a specific nerve in one wrist, Peripheral neuropathy often affects nerves in both hands and feet, sometimes in a stocking and glove pattern. There are many things that can cause peripheral neuropathy. One of the most common causes, especially for people over 60, is diabetes. High blood sugar levels, over time, can damage these delicate peripheral nerves. This is why managing blood sugar levels is so incredibly important for people with diabetes. But diabetes isn't the only cause. Other potential culprits include certain vitamin deficiencies, particularly a lack of vitamin B12. This vitamin is crucial for nerve health, and as we age, our bodies can sometimes have a harder time absorbing it from food. Other causes might include certain medications, especially some chemotherapy drugs, excessive alcohol consumption, kidney disease, or even autoimmune diseases, because there are so many potential causes. If you're experiencing persistent tingling and your doctor suspects peripheral neuropathy, they will likely want to do some tests to identify the underlying reason. This might involve blood tests to check for diabetes or vitamin deficiencies, or even nerve conduction studies to see how well your nerves are functioning. The good news is that for many causes of peripheral neuropathy, addressing the underlying condition can significantly improve symptoms. For example, if it's a vitamin B12 deficiency, supplements can often help. If it's diabetes, careful management of blood sugar is key. Lifestyle choices like eating a balanced diet, staying physically active, and avoiding excessive alcohol can also play a vital role in supporting nerve health. Now that we've discussed carpal tunnel syndrome and peripheral neuropathy, let's move on to other common reasons you might experience tingling hands. Now that we've explored carpal tunnel syndrome and peripheral neuropathy, let's look at a couple more possibilities that can cause that unsettling tingling sensation in your hands. Sometimes, the problem isn't actually in your hands or wrists at all, but higher up, in your neck. This brings us to a condition called cervical radiculopathy, which is essentially a pinched nerve in your neck. Imagine the nerves that run from your spinal cord in your neck, through your shoulder, down your arm, and into your hands. If one of these nerves gets compressed or irritated as it exits the spinal cord in your neck, it can send tingling, numbness, weakness, or even pain all the way down into your arm and hand. It might feel like a shooting pain, or just that pins and needles sensation, and it often affects specific fingers or parts of the hand. Depending on which nerve is involved, this pinching can happen for various reasons. As we age, the discs between our vertebrae and the neck can start to degenerate, or bone spurs can form, both of which can narrow the spaces where the nerves exit. Arthritis in the neck is another common culprit. Sometimes, a sudden injury, like a fall or whiplash, can also cause it. The tingling might be worse with certain neck movements, like turning your head or looking up or down. You might also notice neck pain or stiffness, or weakness in your arm. If you suspect your neck might be the source of your tingling hands, there are a few gentle things you can try. Maintaining good posture, especially when sitting for long periods, is crucial. Avoid craning your neck forward when looking at a computer or phone. Gentle neck stretches, such as tilting your head from side to side or rolling your shoulders, can help relieve tension. Applying warm compresses to your neck can also sometimes provide comfort. However, if the pain is severe, accompanied by significant weakness, or doesn't improve with these measures, it's really important to consult your doctor. They might recommend physical therapy, which can be very effective in improving neck mechanics and relieving nerve compression. In some cases, medication or other interventions might be considered. Beyond structural issues, another often overlooked reason for tingling hands, especially in older adults, can be a simple yet crucial nutrient deficiency. We're talking about vitamins, particularly vitamin B12. This vitamin is absolutely essential for healthy nerve function, as well as for red blood cell formation and DNA synthesis. If your body isn't getting enough vitamin B12, or if it's having trouble absorbing it, one of the earliest signs can be tingling or numbness, often in the hands and feet. It's a type of peripheral neuropathy, but one that is often easily reversible with supplementation. Why is vitamin B12 deficiency more common as we age? Well, as we get older, our stomach acid production tends to decrease, and stomach acid is necessary to release vitamin B12 from the food we eat so our bodies can absorb it. Additionally, some medications commonly taken by older adults, such as certain antacids or diabetes medications like metformin, can interfere with B12 absorption. A lack of B12 can also be a concern for vegetarians and vegans, as this vitamin is primarily found in animal products like meat, fish, eggs, and dairy. If you're experiencing persistent tingling, it's a good idea to ask your doctor to check your vitamin B12 levels with a simple blood test. If a deficiency is found, the solution is often as straightforward as taking a vitamin B12 supplement, either orally or, in some cases, through injections if absorption is a significant issue. This is a prime example of how sometimes the answer to a perplexing symptom like tingling hands can be found in a very treatable nutritional imbalance. It's truly amazing how much our bodies rely on these tiny powerhouses we call vitamins. Now that we've discussed carpal tunnel, peripheral neuropathy, cervical radiculopathy, and vitamin B12 deficiency, let's talk about a few more factors that could be at play. We've covered some of the big reasons why you might experience tingling hands after 60, from localized nerve compression in your wrist to broader nerve damage and even issues stemming from your neck or nutrient deficiencies. But sometimes, the answer lies in other, perhaps less obvious, areas. One such area to consider is the side effects of certain medications. As we age, it's common to be on several different prescriptions to manage various health conditions. While these medications are essential for our well-being, some of them can, as an unintended side effect, cause peripheral neuropathy or other nerve-related sensations like tingling. This isn't exhaustive, but some examples include certain chemotherapy drugs, some blood pressure medications, or even some antibiotics. If you've recently started a new medication, or increased the dosage of an existing one, and then started experiencing tingling, it's always worth discussing this with your doctor. Never stop taking a prescribed medication on your own, but your doctor can evaluate if it might be the cause and, if so, explore alternatives or dosage adjustments. It's a conversation worth having. Another less common but possible cause for tingling hands could be an underactive thyroid, a condition known as hypothyroidism. Your thyroid gland, located in your neck, produces hormones that regulate metabolism. When your thyroid isn't producing enough of these hormones, it can affect various systems in your body, and in some cases, it can lead to nerve damage or compression that manifests as tingling or numbness, often in the hands and feet. This is usually accompanied by other symptoms like fatigue, weight gain, feeling cold, or dry skin. A simple blood test can check your thyroid function, and if it's found to be underactive, medication can often manage it effectively, which in turn can resolve the nerve symptoms. While less common to cause isolated hand tingling, sometimes underlying circulation issues can also contribute to unusual sensations. Conditions that affect blood flow, like peripheral artery disease, can restrict blood supply to the limbs, potentially leading to numbness or tingling, though this is often more pronounced in the legs and feet. However, maintaining good overall circulation is always beneficial for nerve health. This underscores a broader point: our bodies are interconnected, and a problem in one area can indeed manifest in another. So, what's the takeaway from all this information? The most crucial message is this: if you're experiencing persistent or worsening tingling in your hands, or if it's accompanied by weakness, pain, or other concerning symptoms, please don't try to diagnose yourself from this video alone. Think of this information as a guide to empower you with knowledge and prompt a conversation with your healthcare provider. Your doctor is the best person to accurately diagnose the cause of your symptoms through a thorough examination and appropriate tests. They can help you differentiate between something simple and something that might need more targeted treatment. However, beyond seeking professional medical advice, there are also general lifestyle approaches that can support overall nerve health and potentially alleviate symptoms, regardless of the cause. Maintaining a healthy, balanced diet rich in fruits, vegetables, lean proteins, and healthy fats is incredibly important. Foods rich in B vitamins, like whole grains, leafy greens, and lean meats, can be particularly beneficial. Regular, gentle exercise is also key. This doesn't mean you need to run a marathon. Simple activities like walking, swimming, or even hand and wrist stretches can improve circulation and reduce stiffness, contributing to overall well-being. Managing stress through activities like meditation, deep breathing, or hobbies you enjoy can also have a positive impact on your body's nervous system. And don't forget the power of good hydration. Drinking enough water throughout the day supports every bodily function, including nerve health. Remember, every small positive step you take towards a healthier lifestyle contributes to your overall well-being and resilience. It's truly amazing how powerful our bodies are, and how much we can support them with mindful choices. Don't let persistent tingling diminish your quality of life. Be proactive, talk to your doctor, and explore the solutions that are right for you. It's about empowering yourself with knowledge and taking charge of your health journey. Small changes can indeed make a big difference to your health and happiness. We truly hope this video has given you a clearer understanding of what might be causing that tingling in your hands, and, more importantly, provided actionable insights for what to do next. We'd love to hear from you. Have you experienced tingling hands? What helped you? Please share your thoughts and experiences in the comments below. Your insights could help someone else in our wonderful community. If you found this information helpful, please give this video a thumbs up and subscribe to our channel. We're dedicated to bringing you more practical tips and insights to help you live your best life at every age.